All right. So once again, thank you, everyone. Thanks for joining us. We're happy that you're here with us today. This is the Recruitment Outreach and Admissions Office, and we are here to talk about, during our information session, our undergraduate program. All right. So for our undergraduate program, um, it is for those, again, that are in high school seniors that are getting ready to apply, as well as transfer students that may be at their respective university or community college that are thinking about transferring. Again, this is considered a pre-licensed program, right? So again, what this program does is allow you to, after you graduate, after you earn your degree, to be able to sit for the RN license exam for any state that you are interested in. But before we can continue, we should probably introduce ourselves. So my name is Mark Coven. I'm the Director of Recruitment, Outreach, and Admission. Then I have my lovely team member here, Jamie Gama, who's going to be, and it might be on the next slide, but she'll be going over the admissions process. And then we also have Natalie Asensio, who's another teammate of ours. She is currently on maternity leave. She just had her beautiful baby girl. And so we'll be having her join us after a few months, after they're all good to go and ready to come back. So that is the team, the admissions office. Again, myself, Jamie, and Natalie. Okay, so actually what we want to do is we're going to venture off of this PowerPoint and we're going to show you a quick 2 to 3 minute video that we've put together of our simulation lab. And so basically what it is using real life mannequins, right? Again, in a simulation lab, what we do is we've made it look like a replica in terms of a hospital setting. So it really allows our students to get an idea and or experience as they're able to work on our mannequins before we actually put them in a real clinical environment, right? So before they see their patients. So let me do a new share and get us to that recording. Okay.
Good morning. How are you? Good to see you
I
this
do
morning.
discharge instructions.
Yeah, I'm just gonna pass off and Nora's gonna be taking care of the discharge instructions.
I'll be the nurse taking care of you today.
We're gonna start an extra line on you.
Here at UCLA School of Nursing, simulation is a very important piece of the training. It takes a student out of a lecture hall and puts them more into a clinical setting. We have mannequins that have ability to mimic a lot of different patient aspects.
They're able to breathe, their chest rises, they have coughing, wheezing, lung sounds, crackles.
A lot of the higher tech mannequins actually sweat. We can change their pupil sizes. And by computer, we also can change any vital sign similar to a real patient. It's a way to get the students more engaged and to get those clinical experiences such that they don't have to actually practice on real patients. ICU simulations are to mimic the environment in an ICU to add some extra stress, to add some extra equipment that the nurses have now been trained on, and then depict some kind of event that would be typical for an ICU and see how they can react to that event and intervene to make the patient better.
There's a lot of instances where things happen right away. You have to respond right away. It's been able to help me practice my emotions, help me practice how I deal with things.
What's great about simulation is that the student actually gets immersed into a situation. When they get to the ICU environment, it's not foreign to them. The leadership simulation that we do is done for senior students who are nearing graduation. We have 5 patient beds with mannequins simulating an actual clinical floor.
You come in and your nurse will give you maybe like a fast report. They have to go somewhere.
He's a 60-year-old male that was admitted several days ago for an exacerbation of his asthma.
You go to your patient rounds and you go, first patient, okay, you check on them. How are you feeling? Like dizzy? Then you hear like a bell from another room.
Okay, I'll let her know.
I'll be quick. Okay.
The goal is to give them a little bit of stress because we want them to be able to think as a nurse and to be able to think on their feet.
So, Mr. Salter, you're having very low blood pressure. It can certainly be that chaotic during the day. And that's why we have this for practice to put us in those situations so we can learn how to think, what to do.
After each of the simulations, it's really important to come together and have a debriefing. The whole point of the debriefing really is for them to reflect on what they were thinking when they did different things. And then if they would do anything different, how would they do it different?
It's really helped us boost our confidence and also helped apply everything we learned in the books to what we see in the real world.
The goal of simulation here at UCLA is to send students out into the clinical world more prepared and better able to tackle some of the more difficult types of cases that they're going to come upon.
All right, so awesome. Let's get back to our PowerPoint. Okay, so yeah, hopefully, again, you guys were able to see, kind of idea what it looks like as coming in as nursing students, as you get to jump into the simulation lab, before you get into your clinical setting. So that's always exciting for our students as they start that process. Okay, so let's continue on and talk a little bit about the program description. Okay. So again, as I've stated, this program is designed for those that are in high school, right? And or those that are transfer students at the respective school that are wishing to enter our nursing profession and our nursing program. To reiterate, this is a 4-year program, right? For those, again, that are coming as freshmen. So even though you'll come in directly as a nursing student, your first 2 years will mostly be, you completing your general education courses. There are going to be nursing courses as well sprinkled in within those 2 courses or those 2 years. And you will see a sample course sequence later on in these slides. But then again, knowing that the last 2 years, that's where you'll fully immerse yourself in the nursing program, meaning you're taking nothing but nursing classes. And that's when you're actually going to start your rotations. For those, again, that are thinking about transferring, this is a 3-year program currently at this point. There have been talks of trying to create a 2-year program, but right now we only are going to be offering a 3-year. Again, so if you are thinking about joining UCLA, please remember that we are on a quarter system. So for us, our quarters are every 10 weeks. And then also, for instance, we are actually in our first week, or this might be 0 week, but this is the first week of school. Actually, so as you can see, we start pretty, much later than those that may be on the semester system. And then again, so if it's every 10 weeks, for those that come in as freshmen, it will be a total of 14 quarters. And then for those that are coming as transfers, it'll be about 10 quarters in order to graduate. I know you're looking at that last bullet there in terms of the amount of students that we'll be admitting per program. So our goal is going to be admitting 30 freshmen or first year students to start with us, and then also 20 transfers. Okay, so a lot of people ask, hey, why UCLA? I know, I've heard of the university. I know it's a great school from what I've heard of. Maybe I've joined the campus and done a tour and things like that. But what we always like to do is kind of give you, from our viewpoint, why we think you should think about not only UCLA, but, UCLA Josie Wynn School of Nursing. Okay, so again, you may have heard me say this, and if you've attended any other info session, but I love to kind of give this example because, again, I do think it kind of depicts what I think is best about us here. And so when we say small community within the big city, right, you're thinking about UCLA in general. So UCLA, we are in Westwood. And if you ever step foot in Westwood or on UCLA campus, we have everything offered for our students, our faculty and staff, right, that we think any community should have for the people that live there, right? So for instance, at UCLA, we have Ronald Reagan Medical Center, which is #1 hospital here on the West Coast. So we're happy to say that we have the best teaching and magnet hospital here. We also have our own police department. For campus safety. We also have transportation. So we have many buses that come in and out of the university. They take, again, our students, faculty, and staff to their respective homes in their cities. We also have what I feel is amazing entertainment. If it's places to eat, places to shop, hang out. We do have that not only on campus, but here in Westwood. And then also, again, it's going to be on some other slides, but we also have housing available for our students as well. So everything that a community should have for you, UCLA has. Now, if we were to again flip it in terms of an academic side, right? In terms of, what does UCLA have to offer, or more specifically here in the nursing school, we always like to say we're a small community in terms of a nursing department that UCLA has to offer, right? So what do we mean by that? Here at the UCLA Josie Wynn School of Nursing, we have everything that in terms of resources available to make sure our students are successful. So in no particular order, we're going to have our own financial aid office. And so we have a recording from Leonie Thomas, who's going to talk a little bit about scholarships, financial aid, and how to apply. So that part's cool because, there's going to be thousands of students on campus, and you're not going to be just a number, having to speak to some random financial aid advisor in Murphy Hall or an upper campus. You'll be able to speak to Leonie, who's an amazing director, an amazing person. We have a mentorship program that we're going to be starting to put together. Well, we've been doing it for years, but we're going to start to put together for our students again that are getting ready to start with this week. But what a mentorship program is, we like to match up you as a first year student with someone who is in year 2 or year 3, just a year ahead of you or two again. But what they do is they like to, help you out, right? Transition into, the university, into college life, into the School of Nursing, right? In the sense that, they can pass down some notes, give you some ins and out of classes, professors, what class is harder than the other, maybe pass down some scrubs, things like that, right? And so it's a really cool way to kind of befriend someone to get you going. We'll have specialty coaches or people who've gone through the program who've come back to help. We have faculty advisors, student advisors, other people in the student affairs office, again, to make sure that you are transitioning well, that you're matriculating, taking your classes, signing up for classes, and everything like that. So that's just here in the School of Nursing. We have other partnerships on campus, again, which will be in a couple other slides, to ensure that all of our students, again, have all the requisite needs in order to be successful. So we know with all of the effort that we put in from staff, faculty, as well as the people in our hospitals that are help teaching you, we do feel that makes us one of the top nursing schools. So we're excited about that. Okay, so let's talk a little bit about the goals of the program, right? So, first and foremost, we want to make sure that we're going to educate and provide a new workforce of RNs. You guys have probably heard it before, right? Yeah, there's still a shortage of nurses. And so our goal, right, is to make sure that when you enter, we're going to do everything again to help prepare you, right, to once you graduate, get your RN license and be prepared, right, to start working. But with that, we want to make sure that you'll be able to deal with high tech and high acuity healthcare settings. Okay. And more than anything, we want to make sure that you are clinical leaders, right? So when you leave here as a graduate of UCLA, we want you again to know as you go out there, we want, those physicians, those doctors, those patients, other nurses, to know that you've got the best, experience, the best training, the best teaching here. So here's just some of our partnered affiliates is like what we like to say, but they're basically the hospitals that we'll be sending you to when you're getting ready to start doing your clinical rotations. So not limited to all of these hospitals that we have here, right? Only kind of the ones that could fit. But we just want to ensure that you'll be getting a different experience, right? Depending on if you're going to be going to Cedars, right? Cedars-Sinai, you're going to be doing a rotation there. Or if it's at St. John's, we may send you down the 405 South, again, if you're familiar with LA, to Torrance Memorial Medical Center, or back up 405 North to Northridge Hospital Medical Center, which is Dignity Health, right anywhere in between. So you're seeing the VA, Good Samaritan, CHLA, which is Children's Hospital of Los Angeles, if you're interested in peds and children. Of course, UCLA Health, right? So not just Ronald Reagan, but also Santa Monica and even Torrance. And what else is not on? Kaiser. We also have Kaiser. So there's plenty. Um, you most likely will not be doing a rotation at every single one, right? We have a clinical placement team that will ensure that you will be able to, get your rotations in, make sure that you will be getting those hours at, different hospitals. But the goal is, again, to ensure that once you do graduate, you're getting ready to graduate, I should say, there may be a specific hospital that really suits you, right? And so we just want to make sure that you may potentially have that ability to get that experience there before you actually apply and get that job. Okay, so here is School of Nursing enrollment trends and ethnicity. We always like to kind of just show this just to say, hey, we are happy. That we always come in with a wide, diverse, group of students. And we know, again, with all the things that are obviously happening in education, that doesn't stop us to ensure that we want to bring in the best student. And it just so happens that they come from different backgrounds. So we're excited to show you that and see that those numbers have kind of been like that for several years now. So in terms of student life, as you enter the university, you're going to have the opportunity to do a lot of things on campus, right? If it's sororities or it's fraternities or if it's joining other clubs, if you're into sports, if it's intramurals, if you're actually want to play on one of the D1 teams, you can do that as well. But we also have our own student life here within the School of Nursing. So you're seeing the names of them, or at least the acronyms here on the left, and then some of the logos here on the right. And so not limited to just these again, but if you come in and there's not a program, or I should say a organization association that really pertains to you, or there's one that you would want to start, you can always do that as well. And then also what we encourage is that these student groups also become what's the word I'm looking for? A certified student organization on campus as well. And so by doing that, the campus also offers money to each student organization, right? So you could do fundraising if you want to have a graduation, if you want to put on an event. The university does a really good job of outsourcing and helping our students with that. So here are just some of these, taking a look at them just to see, again, if any of these pertain to you. Okay, so as we mentioned before, there are two different routes. So you enter coming in as a first year student or as a freshman and or as a transfer. And so as stated in the video, and I might have mentioned it, kind of briefly here and there, uh, you're not going to start your clinic rotation until year 3 if you come in as an incoming freshman, and or year 2 as you come in as a transfer, right? So again, the first 2 years as come as freshmen are going to be dedicated to you completing most of your general education courses. Transfers, first year is going to be some GEs as well as some nursing courses before we get you ready for your clinicals. But if we were to look at it this way, again, on the quarter system, you're going to be coming in fall quarter, winter quarter, and spring. You're going to be doing Med Surg A, B, and C. And then you do have to have a summer in between. So this one is guaranteed. There could be other summers where it could be optional where you can come in, but this one basically, as you get into, you finish in your second to last year or third to last year, and you get into basically your last year, you will have to do summer. And that's going to be a maternity and peds rotation. So that's always fun. Basically, it's L&D, which is labor and delivery. And so you get to, help mothers become new moms or moms for the second, third, fourth, multiple times. So that's exciting. And then as you get into your last year, again, you're going to have fall quarter, which is mental health. So that'll be a psych rotation. And then winter quarter, which is critical care or public health. Most famous, we like to send our students down to Skid Row, if you've ever heard, that's downtown LA, where it's a population of people that really need, our help. And so our students are able to do rotations there, as well as other places. But that's one that a lot of our students take advantage of. And then for spring quarter, again, which is going to be your last quarter as a nursing student here at UCLA, we have something that's called immersion, which is where at this point, right, as you've done your 4 or 5 different rotations in the other quarters, hopefully you have an idea of potentially what hospital it would be your favorite that you can potentially see yourself working at, and then also that floor. And again, we'll have a clinical placement team that's going to ask you for your top 2 choices, and they try to do their best, again, to align in that with you. But that's where you're going to be immersing yourself in that hospital, in that clinical setting with your preceptor, like who is, again, an individual who is a nurse, who's going to be kind of like your coach, who's going to be right there with you as you're doing your assessments and you're helping your patients. But you'll be simulating, again, what it's going to be like to be a nurse, right? So it's going to be that 12-hour shift, right? If it's going to be during a day shift or a night shift. But along with immersion, it's going to be a project that's involved. So part of that project is if you see, again, somewhere, on that floor in that hospital that you would like to affect, in a positive way, increase it, enhance it, if it's, how they greet the patients or treat them, whatever the case is. You'll go ahead and put a project together, a poster presentation, and then you'll go ahead and present it to the people on the floor as well as your classmates for one day when you do come back on campus. And, from what I've heard, 9 times out of 10, the hospital will implement it, right? So it's really cool in terms of if that's where you end up working or not, you have a lasting legacy. So that's pretty fun. Our students graduate again in the spring, and then they will come back that Monday. So we graduate our students on a Saturday. It's always, or typically is always, Father's Day weekend, just to, put it in your future calendar. Typically is Father's Day weekend, graduate Saturday morning in Royce Hall, which we feel is probably the best location to have graduation. But then you come back Monday and we have what we like to call a boot camp. And so what that is, you come back with our faculty member, typically is Barb Denham, and for about a week, she assists you in terms of how to study for the NCLEX, for the RN licensing exam, right? In terms of potentially how many questions you'll receive, what kind of questions they'll ask, the makeup of it, how long it may take, things like that. What, sort of kind of questions could trip you up and things like that. So Students do that for about a week, and then they go off and they study for about another month or two before they start finally taking the exam, the NCLEX exam, earliest end of July, but most likely it's always going to be in the month of August. So again, just give you an idea as you enter to by the time you graduate, so to the time you end up taking the exam and passing. One last thing I'll say about that, we are still waiting to hear back from our recent grads in terms of how well they did on the NCLEX. But 2 years prior to that, we were 100% first-time pass rate. And then last year, we're at 95, I think, first-time pass rate. So we are happy to say that we're always in the 90 percentile in terms of student success on the NCLEX. Here is a sample course sequence. This one here is looking for those that are going to be entering as freshmen. Again, just to give you an idea, here in the School of Nursing, we kind of have it set for you. Other majors may say, hey, here are the courses you need. Now, you figure out your schedule in order to complete those. But here in the School of Nursing, we like to assist you with that. So basically, it's like matriculating. You have to, as you get into one quarter, fall quarter, into winter and spring, you got to pass them right before you end up going on to the next quarter. So it's really cool in the sense that you know exactly what you need as you're going to year 1, year 2, year 3, and year 4. So I'm not going to go through all of them, but again, just to give you an idea, right? Again, as you come in as a freshman, you're still going to be taking some nursing courses, right? So you're going to be seeing that in 10. And my apologies if this is kind of small, but you'll see, I think Jamie's probably going to put a link to where you'll be able to see the sample course sequence. So feel free to download that as well. But our N10 is a nursing course. It's an intro to nursing and social justice. There will be a math requirement, depending on if you've taken math in high school or AP and passed that AP exam. Same thing with the English. But then there's also going to be a communications or a psychology. Going into winter of year 1, you have N20, which is the second part of nursing and social justice. Then you're going to start your chemistry series. And then math again, depending on if you need to take calculus or if you've already taken it. Then again, you're going to take either one of that course, which is communications or psych. Then spring, you'll have N13, which starts our human anatomy. Then you have chemistry series 14B, second part. And then again, either communications or psych, or most likely what we would want to do, right, is so you wouldn't have to come during the summer. We may implement Life Science 7A into your spring. And then either you'll take your 14C during the summer or you end up taking it year 2. But whatever the case is, as you're seeing, getting into year 2, you're going to have some courses that are going to be electives and or completing your GEs. Year 3 is what I want to show you is where, again, now you've completed all your GEs and you're fully immersing yourself in the program, right? So now you're going to see all the courses that start with an N. So N54B, which is pathophysiology, N152A, which is health promotions, and so forth. Remember, you are going to be coming somewhere in between year 3 to year 4, and that's where you're going to be doing maternity and peds, again, which is your course as well as rotations. And then as you finish up year 4, you're seeing there in the spring, which is going to be your immersion. I believe we have one for transfer, and then I see some questions, so I'll pause after we go over the transfer. But okay, so again, apologize if it's a little blurry, a little small, but as you come in as a transfer student, again, you will be taking nursing courses. So you're seeing N10 and N50, which is Intro to Nursing, Social Justice, right? And then N50, which is Nursing Epidemiology. And then you will have either the prerequisites, which we'll go over to complete, because there's only 4 optional prereqs, or it turns into an elective. Again, you're seeing winter quarter, spring, and then you're going to start year 2. This is where, again, you're going to fully immerse yourself in the nursing program. Come in pathophysiology 2, health promotions, physical assessment with lab, and so forth. And then the same thing as you finish up your year 3, you have your clinical internship, which is immersion. Okay, so I'll do a quick pause to see if I can help answer any questions here, because I see them coming in. So let's see how we can help answer some of these questions. All right, someone just asked really quickly, how can we get the transfer sequence? I'm sorry, you may have already asked that before I read it, but we just put the sample course sequence up there for you. Let's see. Uh-oh. For the mental health nursing course, for the clinicals, will it be in a psychiatric ward? Yes, there is, and a rotation to where you'll be doing that. Yes, and a psych ward. Let's see here. Let's see another one. Sorry, they just keep coming up, so they're moving on me. Someone is saying if I've taken summer courses like lifespan development, psychology, social nutrition, etc., at a community college, does that count towards UCLA? Yes, it can. The easiest answer is this is by saying as long as it's UC transferable, which those courses you've named, they can be transferred as credit here into UCLA as well as the School of Nursing. And in that case, um, you may not have to take those courses once you're in the program, but that doesn't mean that you'll be taking less courses necessarily. The reason why is because you're still going to have to maintain full-time status, right? And so I believe that's like a minimum of 12 units. And the reason why you want to maintain full-time status is that is what's going to help determine the financial aid and or the scholarships that you will potentially be receiving. Okay, let's see. All right. Someone is asking, what's the policy of retaking prerequisites with B's or C's? We will always accept the highest grade. So if you repeat a course, we don't average them out. We take the highest grade. All right. Oh, okay. Going back to a question, someone's asking, does transportation apply to students in the AB area? It does, but at that point, I don't think there's going to be buses that go there, but there are like carpools. So the university has carpools that are available for students and or staff or faculty. But yes. Okay. Is there a wide range of mannequin types in the sim lab? Pregnant women, seniors, adolescents? Yes. It's a great question. Yes. Different ethnicities, right? Different, terms of their skin pigment. Yeah, so we have it all. Yeah, they talk, they bleed, they give birth. So they do it all. And it's a great question because we want it to look like, again, the people that you will be serving as students, as you're doing your rotations, and then ultimately when you graduate. So yes, that's a great question. Okay. Doo-doo. We'll definitely get to some of these. Just want to see here. Okay, someone's asking for a high school student with college credit. Does that shorten the program or does it make room for your schedule to take other classes? Right. So that's a really good question. So for those that are coming as freshmen, if you've completed college credit or AP courses, right, to satisfy some of the credit transfer coursework, it will not shorten the program, right? So again, this is a four-year program, no matter if you come in with no transfer credit or multiple. What it will do is it'll open up, right, some of the course loads. So you'll have the opportunity to take electives and or if you want to minor, then you'll be able to do that. But it does not shorten the program. Whereas other majors, you may be able to graduate within, 2, 3 years. For us, it's going to be 4 years if you come as freshmen, or again, 3 years if you come in as transfers. All right, another good question. Is there any support given to transportation for clinicals? Typically, our students, there will be a classmate or several classmates that have cars. So what we try to do is align that so you guys can ride together and or there are, again, the bus transportations. So people do that. People are also taking ride shares as well. Answer a couple more and then we'll continue going. Okay, good question here. Are there any study abroad options during the 4 years? Unfortunately, there is not. So as you're seeing how jam-packed that course sequence is, our students are not able to do that. And then also, if someone's thinking about doing study abroad, meaning wanting to take nursing classes in other universities outside of the country, they're not able to do that just because of the policies and stipulations. right? We're not able to do that. Transfers may have the opportunity to study abroad if they come in with all the prereqs. But again, it would have to be a quarter where there's no nursing classes that you'll have to take, and or if you're able to maneuver them around. But typically students are not able to study abroad in this program or within the nursing program. Okay, someone's asking, can we double major? No, you're not able to double major, but you may be able to minor, right? Again, depending on how many um, transfer credit you come in. Okay, let's see. People are asking again about study abroad, so I'm going to skip over those. Someone's asking, are there online classes or are they in person? So this is an in-person university, which means all of the classes will be also taught in person and within the nursing program. Okay. Oh, one last thing. People are asking about, and I probably should have stated that earlier. So people are asking applicant questions in terms of the number of applications we received. So thank you for asking that. My apologies for not talking about those when we're giving you the numbers. So again, for those that are going to be applying for a freshman admission, we again are going to be admitting 30 students. Last year, we received over 5,000 applications. For transfers, we admit 20, and we receive, I think, over 400 applications. Now, those numbers sound crazy, but let me give you a quick explanation in terms of what it would look like if you apply, in terms of maneuvering through the application process. And Jamie's going to talk about this, but if you apply to us here at UCLA and in the School of Nursing, there's going to be two applications. You're going to have to submit your UC application as well as your nursing supplemental application. You have to do both in order to be eligible to enter the program. If you do not submit both, or if you submit your UC and not the School of Nursing, you're not eligible to enter. Now, for some reason, we don't know why, and it's been happening for years, half or a third, let's say, of applicants who submit a UC application do not do the supplemental application. So what does that mean? Their application is automatically thrown out. So let's say of the 5,000 plus, we could have 1,000, 2,000 of those that do not submit a supplemental application. Or if of those 400 transfers, it could be 100, right? Maybe 150 or whatever the case is that do not do a supplemental. So it's important for those, again, out here that are with us today, submit your UC application, select UCLA as the campus, select nursing as the major. It's going to tell you, hey, you're selecting a major that has their own supplemental application. Okay, and so with that, you're going to want to submit our supplemental. And so what Jamie's going to go over today is what's going to be included in the supplemental application. So just wanted to run those numbers to you because they do sound daunting, but they don't sound as crazy as what you may see as you Google it. Okay, so continue asking your questions, but I'll continue moving forward, and then we'll pause again. But oops, let's go back. Let's go back. Here we go. So obviously we've been, on this slide here, but UCLA, what they like to say is for students to be successful, they want you to dedicate, a certain amount of hours, right? That wants to be expected of studying inside or outside of the classroom, right? So for each unit that is taken, they say, hey, they want you to dedicate at least 3 hours, a week to it. So for instance, if you are taking 14 units, right? Hopefully 14 times 3 is 42. And so they want you to dedicate, at least 40 hours of studying, per week, and right. And so with it being a full-time program, right, typically, as you work, it's about 40 hours. So again, this states what UCLA thinks it takes in order to be successful. You guys all kind of know what it takes out there, but do know as you get to UCLA, there might be more that's going to be expected of you, right? But again, just wanted to throw that out there for you. And then some other campus partners that we have. Here are just a few. Again, for you coming in as a first year, and that doesn't mean if it's for a freshman or a first year transfer student, we have tons of resources that we would hope you would be able to take advantage of, right? So Career Center at some point as you're getting ready to graduate. We have our Bruin Resource Center. We have, our Center for Accessible Education. We also have CAPS, which is Counseling and Psychological Services. We have our Undocumented Student Program Transfer Center. We have SOUL, which is the Student Organization Leadership and Engagement. And again, that was what I was mentioning earlier. Again, if you want to start your own student organization, you're going to go through SOUL to make sure that it is official. So not limited to, but you're just seeing a bunch of other partnerships that we have here on campus. Here are some others, right? So obviously the Office of Equity, Diversion, and Inclusion. We have student affairs programs and resources, right? So not just here in the School of Nursing, but also on campus. If it has to do with community partnerships, if it's a DASHU Center, if we have any international students, we have that as well. And then we also have other additional things as well. So supporting nursing mothers here at UCLA, office in terms of the ombudsman service, and so forth. We definitely have campus housing. So yes, the university continues to build housing for our students. And so that is something that's amazing. We call it up on the hill, right? Because if you've ever stepped foot on campus or if you've done a tour, the dorms, they are kind of separated from where the classrooms are. So, this is where you're going to get your good walking shoes, get your bike, get a scooter, whatever the case is, to get yourself up into, the housing area. But in it has everything available for our students, right? All the amenities that you need up there. The university does guarantee housing for our students. It's been changing, but I do believe it now fully guarantees, I believe it was at 3 years for freshmen. It might be 4 years now. And then I believe it's 3 years for transfers. But typically what ends up happening is, you'll be in the dorms probably the first couple of years. And then as you get, used to Westwood, you may want to venture out and get an apartment with either your classmates or your friends. But just do know that the university offers campus housing. Also, UCLA also they offer the financial wellness. So we do feel like it's important as you guys are going to be going off potentially for your first time away from home and or certain family members. We want to make sure that we can foster, financial literacy, right? And so understanding what it takes. And so there's coaching, there's online educational efforts, there's workshops to ensure that, you'll be financially literate, but then also just empowering yourself, right? In terms of trying to navigate your finances. Okay, so before Jamie hops on here, I'm going to do another pause to see if we can help answer some questions. I see them coming in, so let's see. Okay, so when people are asking scholarship and costs questions, and so that will be answered by Leonie. We'll go over those. Okay. Someone just asked the website to the applications, so you'll see them here. So that's perfect timing. Okay, so yeah, another good question here. Does admissions consider both the UC application as well as a nursing supplemental application? Or is it just a supplemental application that's considered? So in the School of Nursing, we were only going to review the supplemental application, right? But the university, so members from the university are going to review your UC application. They'll review it, they will score it, and then they will send us down what your score, your ranking is. So we'll get a good sense of how the university looks at you as a student or a potential student as we get ready to review your supplemental application. Then we'll also review it, score it, and then we combine them to then pick our top students. And then from there, what we do is then we recommend it back to the university and say, hey, these are the incoming freshmen and transfers that we would like to admit. So it's a collaborative effort. Okay, let's see. Okay, so someone is asking, can a current junior in high school who's looking to graduate early as a junior still apply to the program? If you are going to be graduating high school early, so it doesn't matter if you're a junior or senior, if you graduate high school early, you can apply. But meaning when you come to UCLA, you would have to have graduated from high school, completed all the requisites from there, to then enter as a freshman in our program. All right, someone's asking, can you apply as a junior from another UC? Yes, you can. But do know again, this is a 3-year program, so you will be coming back basically as a sophomore to complete the 3-year program. Okay. All right, someone's asking GPA requirements. So the university does not have a GPA requirement. Well, I believe that's actually like a 2.75, which is the minimum for us in the School of Nursing. For freshmen, we don't have a minimum. So for freshman admission, no minimum requirement, right? Transfers, we do though. We have a 3.5 minimum requirement for transfer applicants. Now, the average of students who are typically admitted into our program is different. For those that typically come in as freshmen or first years, right? The word is interchangeable. It's around a 4.2, which is weighted. For those that come in as transfers, it's about a 3.8. So again, that's the average there. If you don't have the average, that's okay. All right, a couple more, and then I'll hand it off to you, Jamie. Okay, let's see. A lot of these are application process, so that's why we're pausing. Okay, just trying to find one more. All right, here's a good one here. If you're rejected from UCLA, like the UC app, but you would, uh, okay, I think I know this question. Can you be rejected from the UC application and still have your nursing application reviewed and or vice versa? Right, so your application isn't rejected before we look at your supplemental application. So the only thing that happens is we receive your score, but it's not a rejection or an admit score, right? It's a ranking that they give us that allows us to get a better understanding in terms of how competitive they think you are. And then in the School of Nursing, we review them and then we make recommendations, right? And so the recommendation comes from us, and then the university goes back to double check that they feel that you are a top student. So both applications are going to get reviewed no matter what, basically, to answer that question. Okay, so I'll pause. I'll continue answering some of these, Jamie, as you go ahead and take over.
Thank you, Mark. And I want to welcome everyone today. I know it could be a little bit crazy, especially because the application and everything seems real for those of you who are applying this year. Maybe last year it didn't feel so real, but now it's real. So thank you for being here today. We'll talk about what's required for your successful application for the School of Nursing. As everyone probably already knows, you need to submit 2 applications. So both of you, I will refer to freshmen and first year or transfer students to just to highlight some of the differences when you apply. But both freshmen, first year, and transfers have to submit a UC application and a School of Nursing supplemental application. A lot of you asked us some of these questions in the chat, but the UC application, it's due December 1st. It used to be in other previous years, it's November 30th, but UCLA gave you an extra day this year to do it by December 1st. You must submit a UC application by December 1st in order to gain access to the School of Nursing supplemental application. Once you submit your UC application, remember, we have to be your first choice of major. Some of you were already asking us, what if I get into UCLA under a different major? You can, but unfortunately, if you get into UCLA under a different major, you won't be able to switch to nursing later. Okay, because so that's why we need to be your first choice of major. So you must select nursing as your first choice, and you have to select um, I'm sorry. So you have to select nursing as your first choice of major. You have an option also to do a second major, but we'll talk about that later. Once you submit the UC application, you'll probably get a message that will say, because you selected nursing, remember you need to submit a School of Nursing application. A lot of people miss this step, and a lot of people don't submit a supplemental. You know that you have to do a supplemental. You're ahead of hundreds of people that don't know they have to submit a supplemental app. Okay. So you submit your UC application, you'll get an application ID number. Hopefully, they'll also email it to you so you have it in a safe place. You need that number in order to access our School of Nursing supplemental application. Unfortunately, it won't be like automatic. You won't be able to go to our website and submit the supplemental on the same day because the systems have to talk to each other. So you're going to have to give us some days, maybe a week or two by the time our system recognizes your application from the UC application. Then you'll access our supplemental application. You need to submit it by January 15 of next year. So by January 15, 2026, you will need to submit the School of Nursing supplemental application. And as Mark mentioned before, we don't process your UC application. We actually don't even see it for both first years and transfers. We do not see your UC application. And that's why the School of Nursing supplemental is pretty critical, okay? And this is what you need. So these are the materials you need to submit with it. You need a statement of purpose. You also need a resume that has your work and volunteering experience, and we'll go into detail about that. And you will also need 2 recommendation forms. Okay, so everything it's said you will need 2 application. You don't need to go to nursing class. You don't need to go anywhere. All you need to do is the UC application and the UCLA supplemental application. For for both applications, you'll need a statement of purpose. You are welcome to use, maybe if you feel comfortable, you can use the same essay. Um, but this is the statement of purpose for the nursing application. And this is what the faculty of the School of Nursing are looking for. They will be reading your essay. We promise you, they will read your essay. Okay, so this is what you need to include in your statement of purpose. This is what you need to keep in mind why you want to become a nurse. So you need to write from the heart. You need to, it's like at the same time as your time to shine, right? But you also need to talk about you, like personally, how well you think you're going to do in the nursing program. If you have a goal for a nursing career, that can include maybe if you know about your future interest, or maybe you want to be a midwife in the future, maybe, or if you want to do pediatrics, or if you want to work in the emergency room. I know somebody was asking about level 1 trauma. So it sounds like you're interested in acute, right? So if you have a main goal, by all means, you can talk about it. You can also talk about multicultural experiences, any diversity experiences, and you should include some examples of it. If you speak another language, it's good to also mention it in your resume, but it would be also nice if you can describe how you became bilingual and how you achieved this and how you use your bilingual ability, okay? Then you could also talk about challenges or adversity. In this application, believe me, talking about challenges is not going to count against you. And some people will be like, oh, I don't want to talk about my challenges or adversity. It might not look good. It might make me look weak, but not in this application. Okay, believe us. So if you talk about any challenges, about some examples are like if you were maybe a first generation student. So if mom and dad in your family did not attend college, all the kids in the family are considered first generation. So don't think that maybe if your older brother or sister was first generation, considered first generation, you're no longer first generation. Everyone is. So if you were first generation in your family to attend college, please, you should mention that. And then your accomplishments, like I said, time to shine, right? So if you have something important that you want the reviewer to know, then you also put it in writing. They're looking for a well-rounded applicant, somebody who has some decent, right? Some decent GPA and some decent grades, but also who somebody who will be a good leader, because as a nurse you need to be a good leader. You need to have maybe some community service, right? So you can mention all of that in this 2 to 3 pages. I know it's like a lot to resume in 3 pages, and double space because it's hard to read single space. So we recommend that it's a 3 page limit and a double spaced. Okay. So for your resume, anything I know for high school could be a little bit of a challenge if maybe you feel like you haven't had jobs or anything like that. But this is the place where you need to give yourself credit for everything. We've seen some pretty short resumes, but make sure you list everything. You can list everything that has to do with arts or sports, anything outside of the classroom, you can give yourself credit for. You can highlight your education, any honors. Of course, if you have some work experience, volunteering work, any organizations or association, this is important. This is super important. The reviewers are going to look for your resume for everything. They're going to look for your accomplishments, your community service, your leadership. So they're going to look to your resume for everything. So we have really have no limit of how many pages you can include, but 1 to 2 pages will be enough. And then we'll talk about the recommendation letters. These are actual forms. This is all part of the supplemental, remember? So in the supplemental, when you're in the supplemental application, you will be required to do two recommenders. They could be teacher, counselors, and or if you've had jobs, you can choose a supervisor but not a coworker. So if you had a job, you could choose a supervisor who obviously supports your career goals, and they're going to write the best things about you. And it'll be a little bit tricky when you choose mentors, because if mentors have known you for a long period of time, they can fall into the family or personal friend category. So just be careful when you choose mentoring relationships, because one of the questions could be like, how long have you known this applicant? And they're gonna say they known you since you were like 5 years old. Okay. So these are forms, they're actual forms. They're gonna rank you in different areas. So we usually recommend applicants to have your recommenders, if they're willing and if they have the time, to read over your essay. And then that's going to give them a great idea of why you're applying to a nursing program. And they'll probably write really good things about you, I'm sure. But we just don't want to see something that'll hurt you, like a general recommendation, right? Like something like they don't write any comments, but they can also upload a written letter. You can let your reviewers, recommenders know this in advance. They can upload a written letter, but they don't have to. But it's kind of nice if they do. So they can upload a optional written recommendation, but as long as they fill out our form, it's going to be fine. The deadline for the letters is not the same date as when the application is due. Remember? So the application, the supplemental is due January 15th, remember? But your recommenders have 10 days later, they have 10 days to complete their recommendation form. So the deadline for the recommendation forms, it's January 25th. For our transfer applicants, so high school applicants, first year, don't worry about this. it doesn't apply to you. Okay, only our transfer applicants. Our transfer applicants, you need to complete general education. For community colleges in California, it's called IGETC. So you will need to complete it, and you will also need to complete major requirements. The major requirements are listed on your screen left. So when you visit assist.org, which is the website that tells you exactly the courses you need in order to transfer, it'll tell you exactly the class that you need to satisfy our chemistry, our human anatomy, human physiology, the life science, cell and molecular biology, and also the physiology and human biology. Okay. So it'll tell you exactly the courses you need in order to transfer. It'll also tell you that the prerequisites on the right are recommended, but they're not required. Okay. So the recommended are calculus, communication studies or public speaking, intro to psychology, and microbiology. But let's say that because you were doing general education, psychology was part of your general education, because a lot of people take psychology as general ed. So that's fine. It just means that you'll have a space in our curriculum. Remember, you were looking at our curriculum, and you can see that in our curriculum, there's calculus, public speaking, psychology, microbiology. So you will have extra space in the curriculum. And that's when we mentioned that maybe you could minor if you have enough time to minor in something else. UCLA offers hundreds of minors. If it's anything that interests you other than nursing, you could potentially choose a minor. But then let me say that having more prerequisites completed makes you more competitive as an applicant. So it looks better because you can show the reviewers, right? These are all my prerequisite classes, and I got A's and B's. So they're able to look at your grades from the prerequisites. So having more prerequisites looks better, but definitely because you know that you're applying 1 year before, right? So UCLA only admits for the fall. You technically apply in the fall prior, the previous year. We can work with your plan. Let's say you're taking human anatomy in the fall. That's okay. You can do that. Or if you're missing maybe one chemistry class, the last chemistry class, you can plan it. We can work with your plan, but your plan needs to be realistic. Don't apply if you don't have any chemistries done. It's just an example, but it's just that we will work with your plan. So when it comes to your prerequisites, let us know that prerequisites are in progress, because if we don't see your prerequisite finished or completed, we just assume that you don't plan to take the prerequisites, that you have no plan. But please keep us informed throughout the process if anything changes with the prerequisites, because it's really important to all of you transfer applicants.
All right. Thank you, Jamie. Sorry, it's like my buttons aren't working here. And they see they keep going like back and forth. I don't know why. Okay. So, again, thank you, Jamie, for that. There's been a lot of great questions in the chat. So again, thank you for asking those. Continue asking those, and we'll still answer them. But if you guys have any additional questions after today's session, we don't want it to stop there. We want you guys to continue reaching out to us, ask us, questions that pertain to you specifically, if it's admissions, coursework, whatever the case is. We do have two different email address. You can email either one of them, and it will definitely get to us. And then again, one of us will get back to you as well. Usually takes us no more than a day to get back to you. So again, we have admissions at sonnet.ucla.edu and or at sonnet.ucla.edu. Again, you're looking at the three of us here who are going to be able to assist you throughout the admissions process. So again, you'll get an email from either one of us, and we'll help you. If for any reason you do want to set up an advising appointment, we also do that as well. And so we do have selective days. And so I think I checked the other day, we are booked out through October. So bear with us. Jamie will probably put that link in there. But yeah, so we do 15-minute advising appointments to assist you with that. But then again, if you just have a quick question or questions that can be answered via email, we highly suggest that you just go ahead and email us that way. It opens it up for others. But one last slide before we get to Leonie's presentation. Just to reiterate, like Jamie was stating, the 2 application deadlines, right? So again, December 1st this year will be the UC application deadline. And then we're also going to have our own nursing supplemental application deadline of January 15th. Okay, so let's keep those in mind. I think those are really important. More than anything, it's going to be that supplemental, as I stated before. If you're going to submit that UC, select UCLA as the campus and nursing, as the major, you 100% have to do our supplemental. So please, please, please do that. Some people are asking me, like, in terms of the format of what it looks like on the app. We should probably start to include that. Like we'll do some screenshots next time, and we'll present them during our next info session. But it's fairly easy. What you'll, like Jamie was stating, is you'll get your UC ID number. You'll put that in, and then your information is going to populate, right? So it's going to have your name and so forth. And then what you'll do is it's going to ask you to enter or upload, I should say, first, upload your statement of purpose, right? So you're going to write it in your Word doc, save it to your computer, and then upload it. And then also same thing with your resume or CV. You're going to upload it there. And then it's going to ask you to enter your recommender's information. So that's where you'll enter your recommender's name, their school, institution, company in terms of where they work, and then their email address. And then that's pretty much it. Then you'll go ahead and submit, and then your recommenders will complete that. I did have a question that came to mind. Someone was asking, is there like a format that we're looking for the resume or the CV? No. So resumes, they come in all kind of different forms, right? So, people, put their education first. They may put it last. They may put their volunteering experience first or the work experience. You can format it how you like. We just want to make sure that you're going to put all the important information down, everything that Jamie was stated. But again, how you want to format that is definitely up to you. So those are just a couple of questions that came to mind that I just wanted to make sure that I reiterated for you guys. So continue to ask your questions there. We're going to go ahead and share if I can find it, the financial aid here. Okay, I think this is it. Okay, there we go.
Hi, everyone. My name is Leonie, and I am the Director of Financial Aid at the School of Nursing. Welcome to our information session. I'm so glad you have joined us. In this presentation, I will be sharing an overview of financial aid at the School of Nursing. And we'll be going over a few topics, starting with annual student fees, the cost of attendance, how to apply for financial aid, ways to fund your education, and important dates to keep in mind. Now let's begin with looking at annual student fees for your program. Annual fees are currently set at $14,132. If you are a non-resident, you will need to pay a supplemental tuition fee of $31,026. Fees are assessed quarterly, so a resident student would pay about $4,710 in tuition and fees each quarter. Student fees include UC-wide and campus-based fees. You can find a specific breakdown of all the fee components on the annual and term student fees page on the registrar's website. Health insurance coverage is also mandatory for all students. Students are automatically enrolled in the UC SHIP health insurance plan, which has a fee of $2,785 per year. The UC SHIP health insurance requirement and fees can be waived if you already have adequate insurance coverage. The cost of attendance, or COA for short, is an allowance based on educational expenses that students might incur. So this includes direct and indirect costs, and it's also the maximum amount of financial aid that students can receive during an enrollment period. Here you will see in the pie chart the different components of the cost of attendance. The total projected budget is currently $37,448. You'll see that the tuition and fees is just one portion of that. To begin the process of applying for financial aid, you will need to complete a financial aid application. To know which application to complete, you can reference the information in the table on the right. Most students complete the free application for Federal Student Aid, or FAFSA for short. You can apply at studentaid.gov if you are a U.S. citizen, permanent resident, eligible non-citizen, or a T visa holder. Students that are not eligible for federal aid can apply for state aid through the California DREAM Act application. You can apply at dream.csac.ca.gov if you are an undocumented student, have a valid or expired DACA, U visa holders, have temporary protected status, or meet the non-resident exemption requirements. The application opens up on October 1st of each year with a priority application deadline of March 2nd. You want to make sure to input our school code 001315 so that we can receive your financial aid application if you will be attending UCLA. The outcome of completing the financial aid application is that your expected family contribution is calculated. And this determines your eligibility for financial aid. Now, you can fund your education in a combination of ways, through grants and scholarships, loans, and or work studies. Grants or scholarships are gift aid that you won't have to pay back. And these include grants like the Federal Pell Grant, the Federal Supplemental Education Opportunity Grant, a Cal Grant, the Blue and Gold Opportunity Grant, University Grant, and a UC-SHIP grant for your health insurance. Loan funding is borrowed money that you will need to pay back. And these include direct subsidized loan, the direct unsubsidized loan, a Parent Plus loan, Dream loan for those that complete the California DREAM Act application, and private loans. We also offer several work-study programs. And participating in this, you earn funding through employment. These programs include the Federal Work-Study Program, the University Work-Study Program for DREAM Act applicants, Jumpstart, America Reads, and various community service programs. Scholarship opportunities. So if you are a newly admitted student, you can complete the UCLA prospective undergraduate scholarship application. As a continuing student, you'll be able to complete the financial aid and scholarships general application for continuing students, which usually has a priority consideration date of June 30th. So we always recommend applying by then. We also offer a Regent Scholarship, and this is a renewable scholarship that is based on merit. And we offer a variety of School of Nursing scholarships beginning your junior and senior year. We also always recommend seeking outside scholarships and expanding your overall scholarship search beyond just what UCLA has to offer. Now, before we conclude today's presentation, I would like to highlight a few important dates. As previously mentioned, October 1st is when the financial aid applications open. You can begin filing your FAFSA or DREAM application as of October 1st. Now we start March 2nd because this is a big priority deadline. So make sure to apply for your financial aid by March 2nd. It's also the Cal Grant GPA verification priority deadline. So you want to make sure if you are Cal Grant eligible that your GPA verification form has been submitted. Usually between March and April, your provisional award letter becomes available, notifying you of your financial aid eligibility. And in May, the prospective scholarship application closes. If you missed the prospective, you can complete the continuing student application as well. You can find more information about financial aid on the website financialaid.ucla.edu, or feel free to email me your specific questions at financialaid@sonnet.ucla.edu. Thanks so much for listening.
All right. Thank you guys for hanging in there. Definitely wanted to make sure that we ensured some financial aid scholarship, tuition and fees information. Do know that it is subject to change, right? The university typically is increasing tuition on a yearly basis, even if it's not by much. And so Jamie, thank you, was gracious enough to add the link to the UCLA tuition and fees, as well as the email to Leone's financial aid, just in case you guys have questions. But that does conclude our information session. We are going to hang tight to continue answering any questions that you guys have. But again, we know that we host these in the evening time for you all. So if you need to finish your dinner or even start your dinner or get back to whatever is important, we just want to say thank you again for joining us. We hope to hear from you again, if that's through the application or if you email us, want to set up an appointment, whatever the case is. But I just want to say thanks again. But we'll hang tight and answer any questions. But again, look forward to seeing you guys soon. Uh, okay, thank you guys for those wonderful thank you notes. Okay, someone is asking, how much financial aid can someone receive as a transfer? Does UCLA offer additional scholarships as well? So yeah, it's kind of like what Leonie was stating. So there's still outside scholarships, meaning outside of the School of Nursing. There even may be some outside of the university as well. So yeah, there's definitely more scholarships to be had. In terms of how much can transfers receive or even freshmen, that varies on the individual, right? And so that depends on the need of the student coming in. And so, yeah, based off need or merit, right? And so that's kind of the best way of answering it. We can't give you anything definitive unless you're admitted, and then Leone is able to look at your contributions. Okay, I think I just saw one. Okay, yeah, where can we find the recording of this Zoom? It will be on the same link to where you RSVP'd. So we'll definitely put that up there hopefully next week. I saw another one here, which was, let's see, sorry. Does it hurt your application if you select an alternate major? No, it does not. But you just want to make sure, again, that you select nursing as your first major if you do want to enter the nursing program. Meaning if you select nursing as a second choice, we're not going to look at your application. We're not going to look at the supplemental application. So nursing has to be your first choice. And thank you, everyone. Thank you again. We're seeing all these thank you notes, so we appreciate it. Thank you. Okay, someone's asking, is the application based off points? If so, can we give you a breakdown? Yes, it is based off points, but we're not going to be able to give you a breakdown. So just know the application will consist of, what your GPA is, And then everything that was listed in terms of what Jamie put down, or what she explained, right? So um, leadership experience, multicultural experience, your volunteer experience, if you have any extracurricular activities, things that you're interested in, your letters of recommendations, right? Those get points. Um, the style in terms of writing your statement of purpose, right? Making sure, the edit, it's all edited right? No punctuation, no errors, things like that. So the application, the point scale gets broken down is very minute, right? And so you get a little bit of points for every little thing. Um, what you put in your resumes and so forth. So everything you put in your resume can receive points. Okay, let's see. Okay, a good question. Are there opportunities to explore subspecialties before graduation, like dermatology, peds, and so forth? So dermatology will not be a rotation, but you will have a pediatric rotation. But if there's anything outside of what's offered or what you will be taking in terms of your clinic rotations, we will not be able to offer any additional. So you'll just have those uh, clinical rotations and the amount of hours that you'll have to complete. But I know dermatology, a lot of people are starting to get interested in, and they want to implement that into their nursing career, but unfortunately, we don't have a specific rotation in that. Oh, thank you. Thank you. Yeah. Appreciate these. Thank you so much. This means a lot. That's why we love doing it. So thank you. Okay, someone's asking, do we have a residency program? So UCLA, sorry, UCLA has a residency program, yes. And so yeah, as you get ready to graduate, they will come and speak to our students and talk about the application process, when it's going to open, how to apply, things like that. But if hired, you will be part of the new grad residency program. So, I keep saying the university. The university does not have it in terms of UCLA, but we are partnered with the hospital. So that's the best way of saying that. Okay, someone is saying, what if we go to work and school? Do we need extracurriculars? No, you don't. And that's what's going to make your application more unique or just different from others. We may have people that have to work, others that don't. So whatever your experience entails, that's what we're going to want to talk about in your application. Let's see. Um, Let's seeing some come in here. Thank you guys. Thank you. Um, okay, here's a good one. Sorry, we're just kind of waiting for some questions to come in. Does UCLA TAP program apply to transfer applicants? So it does not for the nursing program. So TAP does not. So that's a good question. Now, I've had people ask, so should I stop, participating in it? No, add it to your resume. But in terms of affecting, right, in terms of priority of admission, it does not. Okay, someone's asking. So let's say for a clinic rotation, if it's in psych, we'll be at one hospital or moving around. So it's a good question. So per rotation, um, you or clinical experience, I should say, you'll be no, let me rephrase that. If you were to do psych, if you're going to be doing your psych rotation, it'll be at one hospital. So you won't be at various or different hospitals. If you're going to be doing labor and delivery, it's going to be at one hospital. Psychiatric, one hospital. ER, so forth. You won't be bouncing around. But that's a good question. All right, we'll hang on for 2 more minutes. Let's see if we can help answer any other questions. All right, another good question. Does CCCP look good on our application? Yes, it does. It does. Yeah. Put, all of the organizations, student groups, all your extracurricular activities, put everything down in your resume, please. It does. Okay, I'll get these two, Jamie, real quick. Does UCLA offer a CRNA program? No, we do not. There's not many CRNA programs in California. And then also, I heard you can apply as a junior. I'm assuming can you apply as a junior if you attend UCLA? Okay. No. So as Jamie stated earlier, we do not accept change of majors. So that means individuals that are at UCLA that are not in the nursing program, you're not able to switch your major to nursing. So again, we admit them freshmen out of high school or transfers outside of the university. So community college or another university. And does UCLA offer an NP program? We do. We offer our new post-BS to DNP program. So that's our new 3-year program. So where you've completed your BSN or even a master's entry, and you'll be able to go through this 3-year program in order to get your NP and your along with your DNP, which is your Doctor of Nursing Practice. Okay, another question is, so say the rotations where one student gets ER and the other gets peds, can they switch? No, so you guys will all be doing the same rotations each quarter. And so if you look at that sample course sequence there, it will really show you what it looks like. Okay, so again, someone's asking the same question. If I'm coming in from a completely different field, how can I make my resume relevant to you? I have experience in graphic design, customer service, sales, but no direct background in medical field. How can I highlight my strengths to stand out? Again, if you're going to be applying without relevant experience and you have experience, again, if it is in graphic design, customer service, and sales, you want to somehow be able to articulate how the experience that you do have equates to nursing, right? So again, customer service, right? The people and the patients you're going to be serving, things like that. So again, your field in terms of where you're coming from. And so you're going to have to see how that experience will help you as you enter the nursing program. But we do highly recommend that you get some type of healthcare experience just to ensure that nursing is what you want. Okay, so we'll probably have this maybe be the last question. Someone is asking, last key piece of advice for someone who's a first-year community college student who's hoping to transfer to School of Nursing. Yeah. As you are entering as a first-year college student, it starts over, right? So pretty much the things you've done in high school in terms of your grades and GPA, things like that, it's not relevant. It's not going to transfer over once you do apply to UCLA. And then, so with that, the minimum GPA is a 3.5, right? So you know what grades you're going to have to receive. But then at the same time, immerse yourself, at your college, get into student groups, get into things that interest you. If it's, volunteer experience or if it's healthcare groups, whatever the case is, right? You're going to have probably about 2 years, at your respective school. So I say just fully immerse yourself academically and in the field of healthcare. And then all of those will translate into when you get ready to apply, right? It'll be on your resume. You're going to gain experience and be able to talk about that when you apply. And then you may also have someone write you a letter of recommendation. So that's what we would recommend. All right. So again, thank you everyone for joining us, especially for those that were hanging in there. Again, want to say thanks. We again look forward to seeing your name, your apps, your email, whatever the case is, as we get ready to start a whole new program. So we're excited. And even join us next month if you want to come to next month's info session. But with that, we'll all let you go. Take care, everyone. Have a good rest of your day.